Shoulder. The shoulder as an anatomical region has two compartments, regio deltoidea and regio glenohumeral joint. Regio deltoidea. The boundaries of this region coincides with those of the deltoid muscle. The region is bounded superiorly by the acromion scapula, clavicle, and the spine of scapula, the origin of the muscle. Inferiorly by the deltoid muscle insertion on the proximolateral aspect of humerus. The skin here is relatively smooth and mobile and is innervated by nervus cutaneus brachiolateralis superior and nervus supraclavicularis lateralis. The external surface of the deltoid muscle is covered by fascia deltoidea. The space deep to the muscle, subdeltoideum space, contains the nerve vascular bundle of this region, made of nervus axillaris and arteria and veins circumflex humeri posterior. These enter the space via the foramen axillare laterale, which projects at the midpoint of the posterior border of deltoid muscle. Ramus deltoideus of arteria profunda brachii enters the space from inferior posterior direction before anastomosing with arteria circumflex humeri posterior beneath the muscle. Two smaller vessels, arteria and vein circumflex humeri anterior, enter the anterior part of the deltoid region at this layer. Deeper, the lateral portion of musculus supraspinatus, musculus infraspinatus, musculus teres minor, beginning from greater tubercle of humerus, lie beneath the posterior portion of musculus deltoideus. Anterior to them is the tendon of the long head of biceps brachii, which runs in the sulcus intertubercularis. Also located here is the lesser tubercle of humerus and the tendon of subscapularis muscle which inserts into it.